My name is Dr. Barbara Persons, and today we're going to be using the EZ platelet-rich fibrin system. I'm going to be drawing blood, centrifuging the blood, and then using it for injection into the lower eyelid skin. Now I'm going to perform a blood draw, and then we will spin the blood and inject it. Okay, this will be really straightforward. We'll perform a blood draw, it won't hurt. Just a tiny little pinch. I'm going to open the centrifuge. I'm going to place my two tubes of blood opposite each other and close the lid. I will then push the EZ PRF system and add 1 minute to spin at 900 RPMs for 5 minutes. And here it starts, it's very quiet. Now while that is spinning, I'm going to prepare my patient's face for injection. We have 3 minutes to go. I've cleansed the face. Now I'm going to mark my cannula port sites. I may do a little bit here. Okay. My rule of thumb with injecting lidocaine or local for cannulas is I just always put the local bleb just above my skin marking. I use a small 31 gauge needle, insulin type needle, and then I will just place a little teeny wheel above each injection site. Okay, that's that. So our centrifuge has just completed its cycle. I'm going to open the lid, and then I'll take out the first vial. You can see the PRF fraction, which is this lighter red color just about 1 centimeter down from the top of the tube. I'm going to pop the top, then I'm going to withdraw the PRF fraction, keeping the tip toward the top, stopping just before I get to the more red. You can get a little bit more out. See that color? Isn't the body amazing? Now to inject this, I'm going to use a cannula. Cannulas will become the standard of care for injectables. The PRF, platelet-rich fibrin, can be mixed with HA fillers, calcium hydroxyapatite, as well as poly-L-lactic acid. The trade names would be things you know like Juvederm, Restylane, Bellatero, Sculptra, Radiesse, as well as our own fat. And we'll inject this today to add volume and rejuvenate the lower eyelid area. In this case, this is a 27 gauge cannula, which is blunt tipped. Just to show you on an alcohol wipe, this is blunt tipped. It's not a needle, it's blunt. So when you're injecting in the delicate tissues of the under eye area, it's much less likely to cause bruising, and then avoids the potential complications of needles, and those can be serious, including blindness. How are you doing?
Good.
Wonderful. Then I'm gonna put that down, and I'll put the cannula through the introducer needle spot. Okay, there we are, we're in.
Can't even feel it.
So, great. How's that feel?
I can't feel it.
Okay. So now I'm going to be placing the PRF. You'll feel a little funny feeling. Okay, 1, 2, 3. Okay, good. And I'm just placing it in these delicate soft tissues under the eyelid. Are you doing okay?
Mm-hmm.
Okay. There we go. It's there. Okay, done on that side.
Oh, wow.
Okay. No bleeding. Nothing. Okay. Other side. Okay, how are you doing?
Good.
Great. So here I'm going to Place the introducer needle. Now I'm going to remove that. I'm going to drop the needle in your lap, okay?
Okay.
Okay. I remove it. Now, take a deep breath in. Distraction. Okay. There's the PRF going in underneath the eye on this side. Okay. And I'm going to take a little bit of my other syringe and use that. Can you hand me the other syringe, please? I won't go. Can I hand you this? Thank you, sorry, no gloves. I'm gonna put a little bit more under the side. You okay? Okay. Now teardrop. Okay.